Hello everyone, we are back again in the middle cranial fossa, and we have gone through this cavernous sinus and the internal carotid artery. And since you have already seen that, you can make that this ridge over here, this small bony strip, elevated strip over here, on this side it would be somewhere here. See, this elevated strip of bone is called the lingula, and this lingula actually guards the internal carotid artery, and theoretically it would prevent the slippage of the internal carotid artery laterally. So this lingula actually packs the internal carotid artery towards the body of the sphenoid. The lingula is here on this side also. It has just been obscured by a drawing, so if we will only go back, you can see the lingula here also. See, here is the lingula. You can make out the lingula here. So medial to the lingula, somewhere here you would have the internal carotid artery, and this area lodges the cavernous sinus. So cavernous sinus, internal carotid artery, and the lingula. Not only that, on the greater wing of the sphenoid you can make out multiple number of openings, of which this is the anterior most opening, and somewhere here, so you have an anterior opening over here, and pursuing in an arc the posterior opening is somewhere here. So from here to here you have a series of openings on the greater wing of the sphenoid. So we will consider them one by one. The first opening over here is this one. This is the foramen rotundum, because it's round foramen. So foramen rotundum, it passes from the middle cranial fossa below. So where does it go below? Below it goes into the pterygopalatine fossa. That is another very complicated portion of the skull that we will come to later. So from the middle cranial fossa to the pterygopalatine fossa below, you have this foramen rotundum, and this foramen rotundum transmits the maxillary nerve. So the maxillary nerve passes through the foramen rotundum. So this is one thing. Then behind the foramen rotundum, this large opening, larger than foramen rotundum, in fact, is the foramen ovale. And this foramen ovale, because it is an oval foramen, this foramen ovale passes from the middle cranial fossa to the undersurface of the base of the skull, where on the undersurface of the base of the skull to the infratemporal fossa. So the foramen rotundum transmitted the maxillary nerve to the pterygopalatine fossa below, whereas the foramen rotundum transmits the mandibular nerve to the infratemporal fossa below. So the foramen rotundum transmits the mandibular nerve, it transmits the axillary meningeal artery, it transmits the lesser superficial petrosal nerve, and it transmits small emissary vein. So mandibular nerve, accessory meningeal artery, lesser superficial petrosal nerve, and emissary vein connecting the cavernous sinus above to the pterygoid venous plexus below. So foramen rotundum, foramen ovale. Now let us erase this to go to our next foramen. Somewhere here is a very small foramen which is called the foramen spinosum. Now this greater wing of the sphenoid, this is the greater wing of the outline of the greater wing of the sphenoid actually. This is the outline of the greater wing of the sphenoid. Somewhere here, close to the tip of the greater wing of the sphenoid, you have another foramen. This is called foramen spinosum. So this small, there is a small foramen over here which is called the foramen spinosum. This is the foramen spinosum over here. Now through the foramen spinosum you have the passage of several structures, one of which is the nervus spinosus, sorry, not with this color. One is the nervus spinosus, and the most important structure that passes is the middle meningeal artery. So middle meningeal artery and nervus spinosus, they are passing through the foramen spinosum. Now this nervus spinosus is actually a meningeal branch from the mandibular nerve, and the middle meningeal artery is a very important artery. It supplies much of the meninges of the inside of the skull. So this middle meningeal artery divides in an anterior division, it divides into a posterior division like this. And what is important is that along with this middle meningeal sinus, middle meningeal artery, you have the middle meningeal vein. And this middle meningeal vein is actually not called middle meningeal vein. It is called middle meningeal sinus because these are thin walled and these create impressions on the inner walls of the greater wing of the sphenoid, impression on the inner wall on the squamous part of the temporal, impressions on the inner wall of the parietal bone also. So it is going right up into the parietal bone. So the impressions that are being created, vascular impressions on the inside of the cranial bones, are mostly the impressions of the venous component rather than the arterial component, because the venous component takes the help of the bone, it hugs the bone because these are weak walls, so they are reinforced by the bony channels. So therefore this is the middle meningeal sinus and the middle meningeal artery and the nerva spinosa. So this middle meningeal sinus, when it drains, it does not always drain into the foramen spinosum alone. It has sometimes an anterior limb and a posterior limb, and it might happen that the anterior limb drains into the foramen ovale and the posterior limb drains into the foramen spinosum. Now apart from these major openings, there are occasionally a few minor openings. Now over here, this is the foramen ovale and this is the foramen rotundum. Now between foramen rotundum and foramen ovale, somewhere here you can have a small additional foramen, that is called foramen of Vesalius. And if you have this foramen, then it transmits just an emissary vein from the cavernous sinus above to the pterygoid venous plexus below. And again between the foramen ovale and the foramen spinosum, you can have a small opening. This opening, if it is there, it is called canaliculus innominatus. And if it is there, then occasionally this nervus spinosus, it can pass through the canaliculus innominatus. But these minor openings are not important. What is important is foramen rotundum, foramen ovale and foramen spinosum, and the temporal lobe, which is lodged in this middle cranial fossa just over the greater wing of the sphenoid. Now if we come to the junction between the body of the sphenoid and the greater wing, over here we just eliminate the superficial drawings. Now if we focus on this part over here, here you have the junction between the apex of the petrous part of the temporal bone and the junction between the body and the greater wing of the sphenoid, and you can make out that there is a jagged irregular opening over here. This jagged irregular opening looks like a laceration. It is not a smooth opening like either the foramen rotundum or the foramen ovale. It's rather an irregular, jagged, lacerated opening. That is why the name of this foramen is also foramen lacerum. So you have the foramen lacerum over here, and over here a jagged irregular opening between the apex of the petrous part of the temporal bone and the junction of the body and the greater wing of the sphenoid. Now although this is a jagged irregular opening, the opening itself is quite large, and this is actually patched up or bridged over by a cartilage. So a patch of cartilage actually overlies this foramen lacerum and blocks it, so that this foramen does not remain a foramen any longer. Now the point is, this blocked foramen lacerum, what actually does pass through it? Nothing significant usually passes through it. A few slips of the meningeal branches of the arteries under the base of the skull may occasionally pass through it. One or two small veins connecting the cavernous sinus with the pterygoid venous plexus, they may pass through it. But what actually goes through the cartilage is that over the petrous part of the temporal bone, you have a nerve called the greater superficial petrosal nerve. So This greater superficial petrosal, it